Good morning and good afternoon, everyone. This is Julie Torode, Deputy CEO of UICC and Director of Advocacy and Networks. I'm very happy to give you an update on the cancer resolution that was passed at the World Health Assembly last week here in Geneva, and give you some early perspectives of what it means for us as cancer advocates. So I'm starting on the first slide just to remind everyone, and I think you're all friends of UICC, so we don't have to dwell here, that the scoping for our work has always been the World Cancer Declaration. And we have here our purpose statement, which is to reduce the global cancer burden, to promote greater equity, and to integrate cancer control into the World Health and Development Agenda. And I hope by the end of this webinar you can see that we have made a significant step towards that in the last week. You've seen this slide before, and it's really just to give you a flavor of all the work that's gone before. You're quite familiar, I think, with the Global Action Plan on NCDs, which was resulted from the high-level meeting in 2011, the second time that heads of state spoke about health at the UN level. What we found in that process is that cancer sometimes gets a little bit lost in the conversation across all NCDs. And as a community working on NCDs, we were very concerned about what was happening with the Millennium Development Goals and what was coming after the Millennium Development Goals in 2015. And so we did have a great year in 2015, seeing that the Sustainable Development Goals did include health, and that NCDs is very much central to that. So as a team, we felt that a cancer resolution was absolutely essential to make sure that the key issues and levers for effective cancer control were very much present in member states' minds, in health community minds, in development community minds, as we move towards implementing the Sustainable Development Goals, but more importantly, also heading very quickly towards 2025. The deadline for achieving the 25% reduction in premature mortality for NCDs, and of course collectively want a significant contribution from cancer in that initiative. So you may have seen these slides before, and I'll just recap for those that didn't join the pre-assembly workshop. But why do we want this resolution? Well, we've just had an update to the statistics on deaths due to cancer, rising from 8.2 million calculated deaths in 2012 to 8.8 million in 2016 already, and it's a lot larger increase than we were expecting. It's been 12 years since the last cancer resolution, and no one really is talking about it. Many of you didn't even know there was one. And as I've mentioned, we're very concerned about making sure that cancer has a good share of voice in the NCD action plans and activities moving towards 2025, but also making sure we're very much in the thinking for 2030. And I hope after this webinar you'll also see that we've given a refreshed mandate to WHO to provide the technical assistance that member states need, and hopefully you'll see how well we've been able to bring in a lot more around cancer plan implementation and access to quality cancer treatment and care. So I won't dwell on this slide. You've seen it maybe before, but it really just shows the journey from wanting a resolution to getting one, and I want to focus on the end of that arrow where we've got the nice green statements. But it was fantastic to see last week, after a very heavy World Health Assembly with a new election of the Director General, Dr Tedros, member states still making the effort to come to our session on the cancer resolution and make positive statements of support. So I would really recommend you have a look at the recording of that session. It's up for 3 months. Especially if you're working at country level, to see if your member state did say something, what they said, because I think it would be really useful for you to pick that up and use it in your own advocacy. And we're happy to share a list of member states that spoke so that you can find it easier. Importantly, 18 member states actually went that further step and asked to be considered a sponsor of the resolution. I think this is quite unusual to have so many countries supporting, and I think it really showed WHO and the community that is involved in the World Health Assembly about how important cancer control is becoming. So it was a very exciting day, and we're very happy to share the links to those actual live recordings if you're interested in them. What we really want to do is make sure that everyone knows this has happened. We started immediately after the Tuesday when the resolution was approved to send out a press release and start some social media activity. And here you can see just how quick the pickup was, even just with one piece of news. We'd really encourage you and your organizations to think about engaging on this, retweeting our messaging, thinking about how you can get involved on social media and show what your organization is doing, because we will be doing a lot more around the resolution in the next few weeks. Today, for example, a blog from me talking about why we think this cancer resolution won't be the paper tiger that maybe the 2005 version was, and we'll be really going out with a lot more information. Our goal is really to make sure that by the time we come to the World Cancer Leaders Summit in November in Mexico City, that there's no one there that doesn't know about the cancer resolution and isn't already thinking about what their commitments might be. So what are we going to be doing? We're sending out quotes. Here we have some examples from our President, Professor Sanchia Aranda, and our President-elect, Princess Dina Mered, talking about aspects of the cancer resolution. So these will be going out. You can find them on our website, uicc.org/cancer resolution. So feel free to use those templates or create your own. We're also providing very simple statements aligned with the resolution. For the slide to come up. So they're very simple umbrella statements, and we welcome you using those. We have them in different languages, and these will be going out sequentially over the next few weeks. So feel free to pick them up, use them in your own way. And of course you can customize them to your own priorities of your own organization. You use the templates that we have. You use your own organization spokespersons for quotes, and really try and drive the story around what you are doing and show how you are committed, contributing to national action. So we look forward to seeing you getting more involved, and if you need any more help there, please let us know how we can help. As I mentioned, those materials are available in several languages as well. But getting back to the resolution, this is why we're on the call. There are several documents around cancer at the World Health Assembly, and I'd recommend you read them all. The best way to search for them is using the top right-hand number, WHA 7012, is the report that WHO prepared prior to support the resolution. This is quite interesting because I've just put the bullets on the right-hand side of the titles of or paragraph titles through the document. So it does talk about the burdens and trends in cancer. It talks about developing and implementing national cancer control plans. It talks about the building blocks of those cancer plans, and talks about what WHO response has been to now, recommendations for member states at the country level, and also actions for the WHO Secretariat. And I think this is a document, together with the resolution, that really consolidates cancer control as a key issue in the NCD and SDG agenda, so the non-communicable disease initiatives through to 2025 and the Sustainable Development Goals through to 2030. It adopts much more specific language on the comprehensive approach to cancer control, and I think those that are more working down the treatment end of the spectrum will see the real wins and improvement in language. So there's a much clearer articulation of the building blocks of cancer plans and developing pathways of care. There's also articulation of actions that are buried at the moment in the Global Action Plan. So the indicators behind those targets are quite strong for cancer, and they're coming through much more clearly in the cancer resolution. And I think the important issue for us as well is really sort of articulating how cancer care can be integrated into broader services, not just with the NCD services that member states are working on, but also thinking across the health plan, and particularly integration with HIV, child maternal health, and services that are quite well established in many lower income countries. So I'm not going to go into minute detail of every single item in the resolution itself, but the next slide really is just giving you some highlights of issues that I feel haven't really been embedded in WHO documents so clearly up to now. So we do have a very clear articulation of the current disease burden, and I think it's important for those words to be written down in a WHO document that this is the second leading cause of death in the world. Quite often WHO documents split up cancers in such a way that cancer falls further down the list in the burden of disease. So it's very important that that's been stated at this level. And also the emphasis on the majority of those deaths being in low and middle income countries, and therefore the imperative that we have to really start to act in those countries. Moving on to the second quote. Again, these are only a few words, but I think they're important. Recognizing that cancer is a leading cause of morbidity globally and a growing public health concern is such an important statement. And I'm sure you can use that in your advocacy, but particularly the emphasis around morbidity and actually thinking about the people living with cancer and the issues that they're challenged with. And then the third quote is really around risk reduction. Many of us working in the prevention area you've struggled to find a quotable citation where we're talking about 50% of cancers potentially being preventable. So this document actually does talk about potential to prevent about half of all cancers. So I think that's a useful step forward. And then you're just looking at some keywords that run through the document. We have, for me, new items, emphasis on addressing inequalities, not just as far as global inequalities are concerned, but really in terms of interventions, encouraging monitoring and evaluation and seeing where people are or are not accessing services, be they at the prevention end of the spectrum or more towards treatment. And it's great to see a reference to children and young adults with cancer, which has been a constant battle to get that reference into NCD documents. I also think there's a real emphasis on scale-up to national programs and population-based programs, which are so essential particularly for prevention and early detection. And there's a lot of language around shaping those programs through evidence and safety and quality of those services, which I think for everyone working in the implementation end of the spectrum, these are important issues to really re-emphasize. And I think new as well is the emphasis across the continuum of care. There's a lot of emphasis on pain relief and palliative care. But importantly, I think, again, for people living with cancer is the emphasis on rehabilitation, survivorship, and follow-up care, which sort of got lost in the NC discourse a little bit. So those are sort of highlights for me. What I would recommend for you is you do read through the document. I know they're boring, but there is so much in there that I think you as advocates can use. And I would also recommend you read the resolution along with the updated version of Appendix 3 to the Global Action Plan. You may recall that the Global Action Plan has this appendix which defines cost-effective recommended interventions for member states. WHO was tasked to update that appendix this time around. It's buried in a document called Preparation for the High-Level Meeting 2018 and has a massive one line in the document, but I have to tell you this was a job of at least 3 or 4 days of drafting and discussion with all member states being involved to get that word endorsed into that document. If you're familiar with it, and I'm going to show some of the segments of it in the next slides, there's a whole set of cost-effective recommendations for cancer control. And the one issue that was preventing endorsement was the discussion around sugary beverages and linking to taxation. Two countries in particular were quite reluctant to endorse the document, and I have to say it's a really useful example of how civil society working at the World Health Assembly can make something happen. We were tracking that progress, which countries having which position. Over the course of 2 or 3 days, we were writing to different ministers of health to make sure they got people in the room. There's 2 committees at the World Health Assembly, and sometimes small country teams can't be in 2 places at once. No one realised how important this was, so people were moving into that committee to make sure their country's views were expressed. And we were able to get basically enough pressure on the 2 countries that were reluctant to sign. And we actually had a very unusual occurrence where the document was endorsed and one of the countries actually disassociated themselves from the decision, and that's a way for countries to let documents go through but sort of have a formal recognition that they're not going to respond to all of the content. And why is endorsement so important? Because otherwise it would not be an update to the Global Action Plan, and the old version would be still in existence and still the recommendation from WHO. So it's a great win for civil society. I think it was a great win for people working in the nutrition and risk factor area, but importantly we didn't lose all of the content of Appendix 3, which is quite vital for moving the cancer story forward. So I recommend you use the 2, and again I've put links to those documents at the last slide, which we'll be sending out to you, because I know they are difficult to find. But the Appendix 3 really does help reinforce what some of the text is saying. So if, for example, we take prevention, there's just one line saying promote primary prevention of cancers, which doesn't give you very much information. But when you look at and cross-reference that to Appendix 3, here I've just cut out the recommendations on physical inactivity. So you can see there's a whole set of interventions that are recommended, and are recommended from the perspective of them also being cost-effective interventions. And then from the perspective of vaccination, some big discussion leading up to the World Health Assembly. I think also because the Global Action Plan, Global Vaccine Action Plan was also being discussed. So we had a quite dilute text in the resolution itself, promoting increased access to cost-effective vaccinations to prevent infections associated with cancer. Bit vague, not really referring to the 2 vaccines that we know are important. But if you cross-reference that and bring in the recommendations that are now recommended in the Appendix 3, you can see that all the key issues and indicators are covered in that document. So the 2 really work hand in hand. If we move on to early detection, I think again this is a really big win in this document. The way the programmatic nature of early detection and treatment is described. And again, if you match it with what is being said in Appendix 3, then this is really a great advocacy document for us. This is the first time that WHO is actually recommending cancer treatment. Those of us that have been working in this area will celebrate the words surgery and radiotherapy in these documents that have somewhat been neglected. And Dan, I know you're on the call, the word diagnosis comes up occasionally. So these are big steps forward for us that have been really trying to get the story of cancer and what that means very clear for policymakers. So I think you can see here that the early detection and treatment of stage 1 and 2 cancers is really emphasized here. We've got cost-effective recommendations for cervical cancer, breast cancer, colorectal cancer, and oral cancers, which I think is a really good place to start for those that are working on their cancer plans and thinking about what investments they need to make. So again, tapping into some of the language across that document, there's some really good language around human resourcing. That's been something that's lacking in the Global Action Plan. So there's a paragraph about mobilizing sustainable human and financial resourcing for your cancer plan. Research does not get left out, and it includes implementation, health outcomes, and cost-effectiveness research, as well as the more classic basic research. And there's language around fostering national and regional multi-stakeholder partnerships, which I think many governments are wanting to try and bring in, particularly around the prevention end of the spectrum. And I think obviously UICC is also keen to start to encourage more partnerships around the treatment end of the work too. And if we move towards the treatment story, we've got a lot more emphasis on multidisciplinary care, training of health personnel at all levels of the health system, and interestingly some nice language around building networks and centres of excellence, all things that we know are good ways of taking cancer care forward. These aren't obviously part of the resolution, but they're two key documents that came out just before and actually this week. The picture is of a guidance document from WHO, which is the list of priority medical devices for cancer management, and goes through all of the different types of technologies for diagnosis, monitoring, and care of cancer. And it's the first time that WHO has made such a recommendation. So I think it's quite a key document for us to get out there and share with our cancer planning teams and our governments. And just the last couple of days, WHO has announced the update to the Model Essential Medicines list, the outcome of this cycle of review of their committee. 3 new systemic therapies for cancer were added. This takes the total number of cancer medicines on that list to 49. The new ones are dasatinib and nilotinib for the treatment of imatinib-resistant CML. And we also got added zoledronic acid, which is for the management of skeletal symptoms of cancer. And for those working in the palliative supportive care area, there were 2 additions from the perspective of pain management, which is quite important to give options for low middle income countries. So these 2 also enhance the emphasis on access to diagnosis, treatment, and care. If we jump back to the resolution, there's quite a few paragraphs in there in the text. I've just quoted 2 to give you a flavour of the types of language that's coming through. So member states are asked to promote the availability and affordability of quality, safe, and effective medicines, in particular, but not limited to those on the essential medicines list. They're also asked to promote access to affordable, safe, and effective quality medicines and diagnostics and other technologies, which again opens up the emphasis for bigger investments such as radiotherapy, which is otherwise not so clearly articulated. And interestingly in the resolution, there's also requests to the Director General, so that will be Dr. Tedros now. And many of you might have heard that there was, as usual, a big discussion around access in this resolution. One of the ways we were able to resolve and get to some consensus was taking the language on trade and TRIPS flexibilities into the preamble. This is an established recognition, and that by taking it into the preamble, member states were able to agree text within the resolution, but they also requested that the Director General prepare a comprehensive technical report for the Executive Board in its 144th session. That actually means January 2019. So I do reach out to the poor WHO team, have pretty much a year, and they will have to submit this in October and November of 2018. It's a busy year for them, and they have to do this as well. And it's, as you can see from this text, a chunk of work. This report should examine pricing approaches, including transparency and their impact on availability and affordability of medicines. include evidence of the benefits of unintended negative consequences, incentives for investment in research and development for new innovations, as well as relationships between inputs throughout the value chain, price setting, financing for gaps in research, etc., etc. So this is a big job of work, but I think this is responding to member states' concerns about the rising cost of cancer medicines in particular, but healthcare more broadly. So WHO is being challenged to really play their role and take a lead in this area. What does it mean for UICC? Well, we really feel we've worked hard to get those global commitments. The 25 by 25 commitment for NCDs, the 30% reduction in mortality by 2030 connected to the SDGs, and the cancer resolution really consolidate all of that. We've got some good guidance documents now coming out of WHO, particularly around cost effectiveness as well. So we really need to drive that, taking that forward now into national action. You can see how our work will be, our advocacy agenda will be supporting the City Cancer Challenge activities of UICC, but we're also looking at driving our capacity building activities. It doesn't mean that we're abandoning the NCD agenda, and it's very much going to inform and drive our processes, and we'll be continuing working with the NCD Alliance, but really focusing at regional and national level now, trying to bring in case studies as more and more successful programs are put in place, but also increasingly engaging our membership to be part of the national discourse. I'm not going to dwell here, but I just want to point out to you that we're really focusing now on getting national impact. We have an overarching campaign called Treatment for All, and we've got a three-pronged approach looking at driving the case for national investment, really calling for equity and access to information, diagnosis, treatment and care, but also expanding our networks of influence with and through our members and reaching out beyond our membership to different areas of health to really drive national implementation. So what's coming next year following this resolution? We've got some emerging milestones that I'd like to share with you as well. In October 2017, WHO will be convening a global ministers meeting on non-communicable disease. That's planned for October in Uruguay. This is really the preparatory meeting for the high-level meeting in 2018. We are expecting governments to start to think through what type of commitments they're going to be making. Between then and the high-level meeting itself, we are expecting some sort of financing meeting to come in. We don't have the details of dates there. But the 2018 meeting will also center around an investment case for non-communicable diseases. So again, the emphasis on the cancer story, investments and cost effectiveness will really help make sure that cancer is part of that conversation. And you'll see at the request to the Director General that WHO is also tasked with working on the investment case for cancer. Importantly, also in the resolution, there's a commitment to do a World Cancer Report. That will be due in 2019, and we've definitely got assurances that UICC can be involved both in designing the shape of that report, but also bringing expertise in for making sure it's as good as it can be and be a useful, informative document for member states on the journey to 2025. And of course, you know that the Global Action Plan runs through to 2020. So the anticipation is that the commitments that are expressed in 2018 will really be the drivers for those last 5 years towards 2025. And of course, there's been a lot of conversation around universal health coverage. Dr. Tedros has very much made it the mantra of his term as Director General of WHO. So it will be interesting to see how that emerging story links in with the NCD agenda. And of course, we'll be very keen to make sure that cancer is very much part of that story. And And of course, 2018, we will also all be meeting in Kuala Lumpur, and we'll be very keen to update you on progress from the high-level meeting at that conference. So I think I will stop there, and thank you very much for dialing in and listening. And if you do have questions, feel free to send them per chat or to ask a question. And I do see that Dan has his hand raised. How do I unmute Dan like that?
The conference has been unmuted.
Oh, hi Dan. What's your question?
Hi Julie, this is Dan Milner. Thank you so much. That was really, really helpful, and I appreciate it. I just had two quick questions. Number one, because the Appendix 3 is buried, the reference that was buried in a document and Appendix 3 is elsewhere, et cetera, is UICC going to pull all of these tools together into sort of a National Cancer Plan toolkit or make them available as like a toolkit? Because I think with Appendix 3 being now endorsed, it really gives countries who haven't started or are trying to struggle through getting their NCP written a real opportunity to map that out. And also the WHO choice process, where the team helps work through these different aspects of Appendix 3 to develop your national cancer plan. Is that something that UICC is hoping, or is there other partners that can help people do that with their national cancer plans using Appendix 3? Because I know that WHO is pretty overworked, and a lot of people may now turn to these documents and say, oh, we can make more progress on our NCP now, but they may get inundated. So is there an opportunity through UICC or some other partner to work through that? And then my second question is, I noticed in the Director General request that he has to work on that it doesn't mention diagnostics. So was that really a request specifically around medicines and access to medicines, or was it access to all of cancer? Because I think that latter would be much more of a challenge to get together by 2019, whereas if it's just focused on medicines, it would seem more feasible. So those are my questions.
Let me start on that question. It's unclear, I would say, from the text exactly, because it does talk about technology. So theoretically, that could cover. It's broader than just medicines. But I think when people say that, they really do mean the medicines, and it's certainly the motivation from member states to look at cancer drug prices. So I think given the fact that WHO really has pretty much 12, 15 months to get this done, it will have a medicines focus. But we do have the opportunity in this next step on the One Health tool, the choice methodology, which shapes the Appendix 3. We have an opportunity to work with WHO. And as you pointed out, Dania, there's not many people. They've got lots of things to do. So I think the one thing that UICC feels is critical now is to get that costing tool into the hands of cancer planners. As you've said, we've got this great framework. Is understanding what financial implications that has. Is that going to be a massive hurdle? And I think the answer is yes, if we don't have this tool. So the advantage of the One Health tool is that governments already use it. They use it for HIV. They use it for child and maternal health. So despite the fact that it might be unfamiliar to us from the cancer community, it is familiar to member states. So UICC is actually pledging to help WHO get the funds together to do this work. So anyone on this call that wants to get involved, let me know, because we do need to find not only money but also some people that can get behind this and help WHO get it done. I think there's advantages that we can all see looking at that timeline. If we can get that work done around the time of the high-level meeting and the World Cancer Report, then it gives us a really good opportunity to use those last few years into the 2025 and help governments start to implement or extend implementation of their cancer programs. So I think this is the key thing that we think WHO should be doing to really help member states in their next steps. We all know people are doing their work, and the focus really needs to be on helping them in practical ways, and how to make a case and have the budget ready for the finance minister is a fundamental stumbling block for so many countries. So I definitely agree that's a key step, and it's something that we would really like to help WHO with. And then your earlier point about the toolkit, yes, absolutely. We would very much now like to take the resolution, take Appendix 3 and make a toolkit that's useful not only for our members but also for member states. We work within a partnership called the International Cancer Control Partnership, where we have documents that are a little bit more focused towards policymakers and cancer planners. So we'll look at a sort of a version that speaks into that audience, but also then a version for our members to use as more of an advocacy tool. So they'll be similar, but maybe with a slightly different tone and focus. So again, anyone on this call that would be interested in getting involved with that and telling us what would work for them and examples of other tools that use resolutions in positive ways, we'd be happy to have a look at that, because that's something we'll be taking on in the next few weeks. I don't see any other questions coming in at the moment. Was that answering all your questions, Dan? Oh, we seem to have lost Dan.
The conference has been unmuted. The conference has been unmuted.
Was that okay as an answer to your question, Dan? Oh, okay. I seem to have lost him. Well, I don't see any other immediate questions. Feel free to send any questions directly to me or through Lorenzo. We're happy to follow up with you individually. I do have, as I said, the last slide includes some key links of the documents that I referred to throughout the conversation, which takes you directly to the PDFs, because I do know how difficult it is to find them. If there's anything else that I've referred to that you don't find easy access to, let us know. And otherwise, I would say thank you very much. We will, Dan, yes, thank you for the questions. Dan, we will send out the slides as a PDF. And if you do want slides to use for other things, I'm sure we can also share the PowerPoints. So, but immediately after this, we'll send out the slides as a PDF for your use. So I will just say thank you very much for joining us, and thank you for your attention. And please don't forget the communications campaign. Please think about how you can help make sure everyone knows about the cancer resolution and how to use it. So thank you very much, and goodbye.